Uterine inversion literally means turning the uterus inside out so that the fundus prolapses through the cervix. Uterus inverts when there is the increase in intra-abdominal pressure, for example in the chronic cough, sneezing, or the subserosal fibroid, or when the fundus is pulled out by a polyp, fibroid, tumor, or the placenta which is present at the fundus, and the active management of the third stage of the labor even before giving the symptometry. It is classified as complete if the fundus passes through the cervix and incomplete if it hasn't. Uterine inversion has 4 degrees. In the first one, or the milder inversion, fundus hasn't passed through the cervix. This is also known as the incomplete inversion as studied before. In the second degree, or the moderate inversion, the fundus is present within the vagina. The fundus is outside the introitus in the third degree, or in the severe inversion. Both the second and the third degree come under the complete inversion category. The fourth degree is known as the uterovaginal prolapse, when the entire uterus along with the vagina prolapses out of the introitus. According to the third classification on the basis of the time of inversion, it is named as acute when it occurs during or immediately after the third stage of labor till 24 hours postpartum, subacute till the 4th week postpartum, and chronic one occurs after the 4 weeks postpartum. As the uterus has inverted, the patient complains of abdominal pain and something coming out of the vagina. She may present with a shock occurring from the hypovolemia from the postpartum hemorrhage or neurogenic shock by the cervical irritation. All the patients presenting with the provaginal bleed, irrespective of the underlying cause, are resuscitated by applying the 2 wide-bore IV line cannulas, taking the blood for sampling, infusing the IV fluids until the type and a cross-matched blood is available for the transfusion. After stabilizing the patient, the uterus is repositioned manually. If this fails, then O'Sullivan hydrostatic pressure method is used, in which 2 to 3 liters of the warm saline is infused while holding the labial fold to avoid the leakage, causing the uterine ballooning, and infusing the ergometrine at the end of the procedure. Surgical options are considered if the patient fails to respond to the conservative methods. This includes applying the spinelli or the Holstein surgical techniques to anchor the uterus within the abdomen, or doing a hysterectomy. If you like our videos, like and subscribe to our YouTube channel. Also, click the bell icon to get the latest updates. You can also follow us on the Facebook at Dr. Sain's official page. Thank you for watching.